Hi everyone. This week we're going to talk about audiology and hearing vocabulary. The first one would be hearing aid that we want to talk about. Most people say audífono, audífono, or you can also say auditory prosthesis, which would be prótesis auditiva. Prótesis auditiva. To say hearing loss, you would say pérdida auditiva or pérdida de audición. Pérdida de audición. You can also say sordera for deafness. Sordera for deafness. This word is a bit controversial, similar to in the US how deafness used to be, well, when someone would say, "Are you deaf?" in a sense, it's a bit more derogatory. People are taking back ownership of the word. So some people who do have hearing loss, like myself, can say something of like, hey, I identify with the hearing loss community, and it's more of an empowerment word. But just so you know, in case someone who's a bit older, more conservative might consider this a bit derogatory. So I would be a bit careful with this one, but I still wanted to share it with you all. You can also have an ear mold within your hearing aid, and that would be your molde auricular. Molde auricular. We also have um, the level of hearing threshold, which is mentioned as umbral auditivo. Umbral auditivo. People won't understand this. I didn't even know that this was something that were said within the ENT world. So most of the ways people understand it is el nivel mínimo de audición. Nivel mínimo de audición, which is just the minimum level of hearing that someone does have. Sensory neural hearing loss is pérdida auditiva neurosensorial or pérdida de audición neurosensorial. Conductive hearing loss is pérdida auditiva conductiva, pérdida auditiva conductiva. A bilateral or unilateral hearing loss could be pérdida auditiva unilateral, pérdida auditiva unilateral, or pérdida auditiva bilateral. Profound hearing loss would be pérdida auditiva profunda, pérdida auditiva profunda. Speech discrimination test would be prueba de discriminación verbal. Prueba de discriminación verbal. Noise filter that sometimes your hearing aids can have. For instance, if you hear a siren and it's super loud, your hearing aids can actually dampen that sound, which is a lot better for patients, especially if you're not used to hearing those jolting sounds. But in order to explain this to the patient, you can say that there's a filtro de ruido. Filtro de ruido. Sorry about that. A cochlear implant is a implante coclear. Implante coclear. The electrodes of the implant would be electrodos del implante coclear. Electrodos del implante coclear. There's also the external processor, the item that you see outside, and that is the procesador externo. procesador externo. You might be wondering why I give you the electrodes and the external processor words, and that's just because sometimes the cochlear implant malfunctions, and you have to figure out which one it is. Is it the internal side, the electrodes of the implant within the cochlea, or is it the external processor? And sometimes I've seen interpreters botch this one a little bit because of those terms, and that's why I felt it was important for me to distinguish both. For the external processor, some people might not understand what it is, but you can say aparato que se pone afuera del oído. Aparato que se pone fuera del oído. If you all don't know with the cochlear implant, you also need to have some speech therapy and a lot of different appointments with the audiologist in order to be able to program that cochlear implant to the maximized hearing range. And in order to explain this to the patient, you would say you have to do cochlear implant rehabilitation. And in Spanish, that would be rehabilitación, rehabilitación con implante coclear. Rehabilitación con implante coclear. As you can see, sometimes saying these bigger words faster tends to be easier than saying them slower. Again, if someone doesn't really understands what the rehabilitation would be, you can also say terapia para aprender a oír con el implante. Terapia para aprender a oír con el implante, which is explaining to the patient what that is. And great, that's it for today. See you next week.